The pelvis and its related joints are the starting point for the kinetic chain of the lower body. If there is an alignment or movement dysfunction, then the rest of the chain is at risk for further dysfunction. Common signs that should lead to suspicion about a hip dysfunction include but are not limited to chronic low back pain, complaints of popping hips, and any reports of foot, ankle, knee, or other leg pain without history of injury. By correcting malalignments at the hip level, many of these aches and pains may be relieved. This video will demonstrate how to check the hips for dysfunctions and alignment issues, as well as demonstrate 2 passive methods for correcting the problems. From an acute fall or blow to a chronic muscle imbalance, the pelvis may come out of alignment for any number of reasons. Though commonly assumed to be immobile joints, there are 3 joints of the pelvis that do allow movement. These joints are the sacroiliac or SI joints in the posterior aspect, as well as the pubic symphysis where the 2 pelvic bones attach anteriorly. Rotations or slips may occur at either or both joints that result in dysfunctions. The pelvis moves in a 3-dimensional plane, so malalignment may occur in any of the following directions: an anterior rotation, a posterior rotation, an inferior rotation, a superior rotation, a lateral rotation, or a medial rotation. To check for malalignment, have the athlete lay supine on a table and adjust them and have them bridged to be sure they are laying naturally to prevent a false reading. First, check their alignment at the ankle by placing your thumbs up into the inferior border of the medial malleoli to ensure both hands are placed in the same spot. Note any difference and proceed to checking the pelvic alignment. To do this, find the ASIS and press the thumbs into the inferior border to again ensure both hands are in the same spot bilaterally. Note the rotations. Though difficult to see from the photo, our subject is rotated superiorly, laterally, and posteriorly on the left, the opposite on the right, as will always be the case. The next step is to check whether or not the SI joint is functioning normally. To do this, place the thumbs on the PSIS with the hands resting on the iliac spine. Have the athlete bend over and observe the levels of the thumbs. Next, have them alternate pulling one leg up to their chest while you observe the movement at the SI joint. Note any differences, delays, or total dysfunction. You can see that our subject has a dysfunction on her left, while the right is moving normally. To correct dysfunction of the SI joint, we first employ the hang and shift method. First, have the athlete lay supine with the leg on the dysfunctional side hanging off the edge of the table, as shown. This allows gravity to help open up the joint. After laying in this position for 2 minutes, have them shift. To shift, the athlete places their arm on the involved side directly in front of them while leaning on the wall. Their other hand gets placed on their hip, and with their feet about a foot away from the wall, they shift their hip into the wall to open up the dysfunctional joint. Repeat this 30 times. Once the set is complete, recheck their movement and repeat if not normal until they have been corrected. Once moving normally, the next step is to correct any remaining malalignment. Blocking allows this correction in a passive manner by using gravity and body weight to shift the body back into alignment. Rolled towels are used in this demonstration, but foam wedges are the ideal tool. Blocking follows the idea that by pushing the pelvis back into neutral and allowing gravity to pull on the involved musculature in the direction of neutral, the correction is more likely to last because the body is moving itself instead of a forceful mobilization. Since our subject was superior, lateral, and posterior on the left, our blocking will start by placing the towel posteriorly while angling it to force the pelvis medially and inferiorly. After 2 minutes, the athlete should lie prone with the towel on the anterior aspect of the opposite hip, angled in the opposite direction to force it to neutral. In this case, laterally, superiorly, for 2 more minutes. As long as gains are being made in the direction of getting the hips back into neutral, this process should be repeated. As soon as no more gains are being made, it is time to either wait until a later date or time, or try a more aggressive method. There are many methods for resetting the hips into a neutral position. Some are more aggressive than others. It is up to you, the athletic trainer, to find what method works best for you and best for your athlete.